I've been joined by Berne Gibbons, who is an advocate for AI Med in Australia. The AI Med breakfast briefings just wrapped up. We had some fantastic speakers, wonderful experiences being shared with the crowd, and some excellent questions at the end of the panel. Are you pleased with how it went today?
I'm very pleased with how it went, not only with the attendance, but also the interest around the clinical ability that can be achieved with using artificial intelligence in medicine.
Why are you so passionate as an advocate for this cause, and why do you think it's so important for the future of healthcare in Australia?
I think that we have all of the data that we've been collecting with different digital medical records and the way that even pathology, diagnostics are used. We need to now use all of that information and the demographics, and then we can achieve better clinical outcomes for patients.
I'm going to ask the big question. Do other countries do it better than Australia? Are we a little bit behind? Is that what AI Med's going to try and achieve to bring us back in the loop with the rest of the world? Or do we have other strengths?
We are behind with AI. We're also behind with digital records as well, and how we interoperate and share our the data that we have. We can do much better than where we are right now.
And is that what the conference in November is going to achieve, really bringing people together in the same room to talk about this, nut it out and really have that discussion?
Absolutely, and not just, we're not waiting until November. We're going to be having other events and pulling together a really strong community in AI Med before the event, and then we'll all arrive in November and have relationships, and it's going to be a great 2 days pulling together great conversations.
How can people find out about those events you speak of and get involved in the movement?
Sure, they can go to Best Case Scenario to our website, find us on LinkedIn, or just go at #AIMedAustralia.
And I imagine you're contactable and you'd love to hear from clinicians and people out there who want to share those experiences and have problems that need to be solved.
Yes, let's start talking. That's what the community is about. And whether it be on LinkedIn, on Twitter, or contact me directly, I am Berne at BerneGibbons.com.
Fantastic. Thanks for joining us today. Thanks for hosting as well and making such a fantastic breakfast briefing. It's the beginning of huge things.
Absolutely. Thank you.
You've been listening to Alexi Berne here at the AI Med breakfast briefing in preparation for the summit that's happening in November. And as Berne mentioned, lots of other great things to get involved with as well. So find out more, see how you can be involved if you're a clinician or a patient or someone who's in the AI industry. It's the beginning of something huge. Thanks for joining me today, and we will be live on podcasts. Check us out online and see if you can find other great podcasts from the AI Med Australia movement.